Thank you guys for joining me again. I appreciate you being on. I'm happy to have you guys, and I look forward to having this discussion because it's really important one. And I can't tell you how many times I've had patients just either just completely just not understand all the different things that go into maternity care or what they should expect or what they should be doing. And I just figured that this would be a good topic of discussion for Women's History Month. Okay, so it's 8 o'clock. Hi, hello again, everybody. It's Dr. Thorpe Mize. This is the Q&A session for the month of March. I'm so excited to have you guys back with me again. And this month we are talking about preconception, pregnancy, and then postpartum, meaning after you've had the baby. So we want to talk about what kind of things should you be considering during each part of the process. And so the key points that I went through for preconception was to make sure that you work on achieving a healthy body weight. So if you are planning on becoming pregnant, you decided to have the conversation or you're thinking about it, and you want to go ahead and get started, start working on achieving a healthy body weight if you're not already there. Work on if you have any acute or chronic medical problems. So, meaning if you have any um, acute illnesses, means like a virus, any infections, particularly the ones that we are most concerned about at this time is STIs, so sexually transmitted infections, making sure that those, if they are ones that can be treated, that they're treated before you move forward. And then if you have any chronic conditions such as like diabetes, thyroid dysfunction, anything like that, that those things are being addressed prior to getting pregnant. um, and then make sure you start a prenatal vitamin or take some folic acid supplementation. The recommendation is 800 milligrams of folic acid per day. And the reason why we recommend that is really to minimize the risk of neural tube defects. So if you are in the stages of planning on becoming pregnant, these are all things that you can go ahead and start working on. Now, if you just, you got pregnant, you didn't really plan on it, but you're here, what do you do now? Or you planned on it and you're pregnant now, you go ahead and make sure you have an OBGYN if you didn't already find one during the preconception planning. Get an OBGYN and make sure you attend all your prenatal appointments. I can't stress that one enough because sometimes people, there's some people who don't really understand the importance of going to those appointments, because at each appointment we're monitoring, we're measuring, we want to make sure everything is good with both mom and baby. And so it is important to attend all those appointments. Now that you're pregnant, you want to make sure that you're continuing those prenatal vitamins or doing the folic acid supplementation. And then one of the things that I brought up in the video, and I want to mention again here, is if you have vaginal bleeding in pregnancy, that needs to be evaluated in person. So you do not want to do a televisit for vaginal bleeding. Vaginal bleeding needs to be evaluated in person, okay? And it is actually quite common that in the first trimester of pregnancy that women can have some vaginal bleeding, which, we consider that there are different reasons why you can have vaginal bleeding in early pregnancy, and sometimes it's a what we call a threatened miscarriage, where you can get some bleeding from the uterus, but the pregnancy itself is still healthy. Sometimes it could be actually an ectopic pregnancy if you haven't if you haven't been evaluated yet to determine if you have an intrauterine pregnancy, which means that that pregnancy was implanted in the uterus appropriately. Or you can get like an early pregnancy loss, which is what most people typically think of as a miscarriage. So, because of the fact that it could really be any of those things, you really need to get that evaluation done in person. And then if you are one of the people that carry your pregnancy to term, or you carry your pregnancy to a point where you now have your bundle of joy, um, the next step is for postpartum care. You want to make sure you're attending your postpartum appointments, because, again, you can have complications from pregnancy, and you can have, like, there are common postpartum medical complications that can happen. One of them being gestational hypertension, meaning high blood pressure that occurs during your pregnancy or directly after in the postpartum period. Or it could be gestational diabetes, or maybe you had diabetes even before getting pregnant. All of these things are things that require long term follow up, and definitely require immediate follow up in the postpartum period, because that is a critical period. And the other thing that I touched on was about postpartum depression, which can occur far beyond the 12-week postpartum period. Now, a lot of people will say, will, feel like they are either, oh, I'm a new mom, or now I'm a mom of multiple children, and, it's just a lot of stress. There's a lot to deal with. And you think maybe this is normal. If you're unsure in any way, definitely have that discussion with your doctor, because sometimes those blues that you're feeling is depression, and sometimes that can carry, like I said, beyond that 12-week period. So even though postpartum visits are typically done during that time period, if it's happening beyond then, please see your doctor, please talk to someone, because that is a critical time for both mom, baby, and family. And another one of the things I wanted to touch on was breastfeeding. So many people, now we have all these campaigns that encourage us to do breastfeeding, and it's definitely something that I recommend to my patients. It's obviously great for mom and baby. If you are having difficulty with breastfeeding, you can typically have lactation consultation. There are some of us docs who do um, specific care for, or training for, helping moms with their lactation concerns. So definitely bring it up with your doctor. And if you are one of the moms that decide, well, you know what, breastfeeding is not for me, and there are many reasons why people will decide that they don't want to do it. So while I do absolutely encourage it, if you either are not able to, or it's just something that you don't desire, then absolutely have the discussion about what formula options there are, and what is the best option for you and your baby. This is one of the great things about medicine. We have options. And so all that's required for you is just to have those discussions. So make sure you're having these discussions with your doctor. So those are all the things that we talked about in short. So I'm going to go ahead and open it up for questions. So if any of you out there have any questions about preconception care or planning, maternity care, postpartum care, please go ahead and text those, or write those questions into the comments, and I'll be happy to answer. And I do know that some of you told me previously that, you're not able to go ahead and write questions in because of the platform that we're using. So if you have my number, feel free to text it in to me. If you have my email, please feel free to send them via email. I am going to be checking those too as we go along, to make sure that I'm answering all your questions. Okay, so that was a lot. And I do think that, because it's a lot, sometimes it's a lot to digest. So I like to give people a few minutes, but we will also want to keep things moving. So again, as any questions come up, be sure to go ahead and type them into the comment section, and I'll be happy to answer them for you. We are talking about preconception care, maternity care, and postpartum care. And I'm so happy to have you all joining me today. Okay. So, I know that some of you are shy, or some of you, um, you know, don't have the ability to type those questions in. So I like to come prepared. Some of you already sent me some of your questions, so I'm gonna go ahead and answer one of the questions that you already sent me. Um, so one of the questions was, I love having my glass of wine. Why should I stop because I'm pregnant? Okay, we do not recommend having alcohol during pregnancy, um, because it really can cause harm to the baby. You can end up with difficulties in the pregnancy itself, but you can deliver a baby with low birth weight, and that's not, not something that we desire, among other things that can happen. But we do not recommend ingesting alcohol during the pregnancy. So when you give birth, you can go back to your glass of wine and enjoy. And typically, in that, once you've given birth, and if you are breastfeeding, we typically recommend that you, pump, and we call it pump and dump. So you're, after having that glass of wine, you want to, pump that next breast milk, so that the baby is not actually ingesting any alcohol in the breast milk. Okay, so you would just have to give it some time, and you'll be right back to drinking your wine again. Okay. Any additional questions for me? And like I said, I have some questions here that people sent in beforehand. So I'll go ahead and answer those to the best of my ability. So send in your questions in the comments. Again, we're talking about preconception planning, maternity care, and postpartum care. And one of the other things that I wanted to bring up is, sometimes we as women, especially in the society that we're in now, so many of us work, or work towards careers that keeps us so busy, and there's always this question about whether or not it's the right time to have a baby. Is it the right time? So even when you are, with the right partner, you feel like you're ready, you question the timing. And what I have to say about that is, no one can really tell you what the best time is for having your baby. Uh, and I say life happens, if it's something that you desire and you want to, go ahead, have the conversation with your doctor, and then make the decision with you and your partner about moving forward. The other thing is about, career women. A lot of us are waiting until later, until we've achieved a point in our career where we feel like we're ready now, before, going ahead to have a baby. And so if you are someone that's considering waiting until you've achieved all your career goals, and you're concerned about, maybe potentially it'll be too late if you wait, what I would say about that is there is always the option to freeze your eggs. There is an option to do that. You can always reach out to, we have GYN specialists that are fertility specialists that would be happy to assist you in that process. So there are options for those of us who do want to pursue other things first. Now, another question that just came in: are there any supplements beside folic acid or prenatal vitamins that I might need during pregnancy? Uh, so, if you are someone who has you've had your physical, you're 100% healthy, your lab work is normal, then no, there aren't additional supplements that we recommend. It's really just the folic acid. However, if you are someone who has, gotten your lab work back and you found out, oh my gosh, I'm actually a little bit anemic, or, anemic to the point where you require iron supplementation, then, your doctor would then recommend iron supplementation at that point. Some of us have other vitamin deficiencies, And if you have a vitamin deficiency, your doctor would be able to tell you which vitamin deficiency it is and how much of a supplementation is required to get you back into normal range. But for a quote unquote normal, healthy individual, no, only the folic acid supplement slash prenatal vitamins are recommended at this time. If you're concerned about anything else, touch base with your doctor. If you have any ongoing medical concerns, if you have any medical problems or chronic medical issues that are currently being addressed with medications, then it is possible that you do need additional either supplements or medications that you need to be taken during the pregnancy. And so I typically recommend touching base with your doctor for that one. After a certain age, sometimes there is a recommendation for taking aspirin, and so again, it's a conversation with your doctor, because what I don't want to do is say, "Oh yeah, all of you go take these aspirin." No, it's not. Um, a lot of these things are on a case by case basis. So the only one that is a blanket recommendation is to take a prenatal vitamin that has folic acid, or just the folic acid supplement. And like I said, the amount that is required for that one is 800 milligrams per day. Okay. Any additional questions regarding any of that? And again, for those of you who are either just joining us or have been joining us, but are unable to post your questions on here because of the platform, we are talking about preconception care, maternity care, and postpartum care. And if you have any questions and you know me personally, you can absolutely just text those questions in. Um, but if you are on the platform and you're able to, go ahead and type them into the comment box, and I'll be happy to answer them for you. And I hope I was able to answer the last question for that person. Let me know if you all have any additional questions. So, one of the other questions was about how much weight gain is appropriate during pregnancy, and that's another one that actually is very specific to the person. But I'll give you some ranges. And a lot of these things are based on BMI. So really, we're looking at BMIs. Uh, if you are someone who has a BMI that's greater than 30, then the amount of weight that is recommended is actually less than someone whose BMI is less, right? So for a BMI greater than 30, 11 to 20 pounds is the recommendation. And then for those less that BMI less than 18.5, who those people are considered underweight, they can gain anywhere between 28 and 40 pounds. Most people, and most people will gain about 2 to 4 pounds during that first trimester, and then about a pound a week for the rest of the pregnancy. Um, but the amount of weight gain actually depends on your situation. So again, a lot, I give you a lot of this information. I want you to kind of think about it, but I also really want you to have discussions with your GYN, your OBGYN, or if you're in the planning stages, with your primary care doctor before going further. I will never tell you anything that's going to be harmful to you. So I want you guys to take this information, but I also want you to have discussions with your doctor. Okay. Any additional questions for me? I'm so happy to have you guys joining me today. Again, we're talking about preconception care, maternity care, and postpartum care. So, what do you do before you get pregnant, during the pregnancy, and then directly after the pregnancy? That's what we're talking about this week. Okay. So I'm going to go ahead and answer for you another question that someone sent in, which is, what foods do I avoid during pregnancy? So the ones that I'm gonna mention are, one, soft cheeses, or any unpasteurized cheese or milk, um, or things that are made with unpasteurized cheese or milk. Um, you want to avoid kind of having hot dogs or luncheon meats unless they're like um, heated to the point where they're steaming hot, which usually is like right after they're made, or you can reheat them. And then like pate or like meat spreads, you want to avoid those. Avoid smoked seafoods, raw produce without washing. So that you want to make sure any raw produce that you're going to consume, you wash it first. Um, and the main thing with the soft cheeses, because some people will say, well, I had that in my pregnancy and nothing happened. Or I don't see the point of me having to avoid that. I eat that all the time. Why should I have to stop now that I'm pregnant? And the thing about that is, yeah, you did have it, before you were pregnant, and it was fine. And you may have even had it in a pregnancy and it was fine. But the real risk is that it putting you at risk for contracting listeria. And listeria is a type of bacteria that can be found in soil, water, some animals. And so when you consume foods that may potentially have listeria, it can cause what we call listeriosis. And it can actually be a severe type of food poisoning for pregnant women. And typically, pregnant women are actually 10 times more likely to get it than anyone else in the general population. And so the vomiting and diarrhea, then, so that's what I mean by that, severe food poisoning. The vomiting and diarrhea that can come from that can cause you to lose too much water, and lead to dehydration in essence. And what basically can happen as a result of that is it can cause you to have a miscarriage or a stillbirth, or lead you into preterm labor. All of those things are things that we want to try to avoid. And so that's really the reason for avoiding unpasteurized milks, foods with unpasteurized milk, like soft cheeses. You want to avoid lunch meats. And for the same reason, with lunch meats, they're also high in sodium, so that's another reason. But if you must, which some people are like, that's what I'm craving and I really want some. If you must, make sure you heat it to the point where it is steaming hot, just before serving, and that's the way you would have that. But you also want to make sure that you avoid having undercooked meat. Some of us like to eat raw steaks, and so you're putting yourself at risk for various types of bacteria that comes from eating undercooked food. So I just want to caution people, to really minimize those things. No raw fish. And matter of fact, you want to limit the amount of fish intake that you're having during pregnancy. So those are all the different types of foods that you really should avoid in pregnancy. But you know what I say, and I've been saying it this whole time. If you are really concerned, have a conversation with your OB, have a conversation with your primary doctor if it's before pregnancy. These are all things that I do think, and as a primary care doctor myself, I really do like to take the time to have the conversations with my patients because it is important. We want to make sure that you have a safe and healthy pregnancy, and being educated on things to avoid and things to do is part of that process. We just want to make sure that you are healthy throughout the pregnancy and you bring a healthy baby into this world. Um, so again, thank you for that question. For anyone else that have any questions, please feel free to text that into the comment section, or you can, again, if you have my number, you can also text me a question directly if you are unable to place it on our comment area. Again, I'm Dr. Thorpe Amize with Amize Health. I'm so excited to have everybody here with me. We're talking about preconception care, maternity care, and postpartum care. We do these conversations once monthly. So um, each month I put, one video out per Monday, for 3 Mondays in a row. And then on the fourth Monday, we sit and we have these Q&A sessions, so that I can answer the questions that you have that pertain to those videos. If you miss the videos, that's okay. You can catch it on the website at www.amizehealth.com, or you can watch them on this YouTube channel at Amize Health. Okay. And you can follow me on all the other social media platforms also at Amize Health. So, we will continue to do it this way. If you have specific topics that you want me to discuss, you can always either send us a message in the comment section. You can send me a message on one of the social media platforms, or a message through the website. So you have many ways to reach me to let me know what it is that you want to hear about. So to continue for today, we've been talking about preconception care, maternity care, and postpartum care. And we've had some great questions thus far. And if you all have any additional questions, like I said before, feel free to text them into the comment section, and I would be happy to answer. So I'm looking here. So we got another question here. I get tired a lot since I got pregnant. Is this normal? Do I need to exercise? Okay. So I really like this question. I'm going to tell you why. Because it's actually two questions in one. So I'm going to answer both parts of this question. And the really tired in pregnancy, that happens to many of us when we get pregnant. Doesn't happen to everybody. Some people seem to have a burst of energy, but most of us do get a little bit more fatigued. And part of that is, if you think about it, and not even from a medical point of view, but if you think about it, you're growing a human being. And so yeah, that's going to make you a little tired. And you are now having a lot of nutrients that is being shuttled to that part of your body to grow this human. So um, that's likely part of the reason why you're tired. um, and we do recommend that when you can, you get those naps in, get rest in, make sure you're staying hydrated. Sometimes it's dehydration. You want to make sure you're eating adequately. Now, there is a misconception that, okay, now I'm pregnant, I need to be eating for 2 or 3, and I get to eat whatever I want. And to a certain extent, that's true. But like I mentioned in the last question, you can't just eat whatever you want. There is some limitations. There are some restrictions that we do recommend, but it I don't want you to so much think about just that you're eating for multiple people, because that baby is going to grow. You want to make sure that you're eating the nutrients that you need, you're eating healthy. um, and I can't stress the hydration part enough. But the second part of this question is, do I need to exercise? Now, if you are someone that was exercising a lot before you got pregnant, guess what? You can continue to exercise. If you were someone that was like walking, I don't know, walking a mile a day before pregnancy, um, this is not the time for you to start doing hot yoga. Okay. If you were not doing it before, talk to your doctor about how you can ease into exercising. Okay. So you do not necessarily have to just start trying to run a marathon now that you're pregnant, because you probably will feel a little bit more fatigued. Again, you're growing a little human. And exercise is good, because it will be helpful for the process when it comes time for delivery. So I do recommend that you do some level of exercise. And if you weren't exercising before, starting with some light walking will certainly be helpful. But like I said, I recommend doing some exercise, but this is not the time for you to start kicking into high gear exercise. And there are some things that we do recommend that you limit, especially as you move along in the pregnancy, because what happens is, as the fetus and as the baby is growing, your center of gravity shifts, and so it makes it a little bit more challenging for you to maintain balance. And so you don't really want to do activities that require a lot of balance, like for instance being on a bicycle, or being on riding a horse. As you move further along in the pregnancy, you want to be mindful of the things that you're doing. Like I said, if you weren't doing them before, this is not the time to start doing exercises like walking, like swimming. You do get some aerobic exercise, but it's not heavy exercising. And then again, if you have any questions about how much exercise you should be doing, or if the exercise is working, or how much exercise should you limit, absolutely talk to your doctor. If you were already doing a lot, usually you can just continue um, in the pregnancy, unless there are things going on in the pregnancy that would make your doctor tell you to stop. So even though I'm telling you you could potentially continue, it is a conversation that absolutely needs to happen with your doctor, because we do not want you to harm yourself or the baby in the process. Okay. But that is an absolutely great question. It is, if you are in the preconception phase of planning, if you are thinking about becoming pregnant, that's one of the times that you really, maybe that's when you should start exercising if you haven't already. Because remember, one of the points that I made when we talked about preconception care was work on achieving a healthy body weight. So if you're not already there and you're in the planning phase, absolutely get going with that exercise. It can only do you good. Okay. Um, but if you are pregnant, or, as you move along in that pregnancy, your exercise tolerance is going to change. So have a conversation with your OB about it. We don't want you going out, doing too much, or harming yourself. And if you are exercising, hydration, hydration, hydration. You want to make sure that you stay hydrated, because, like I mentioned before, dehydration puts you at risk for early pregnancy loss. Okay. All right. Keep the great questions coming, and we appreciate them. You guys have been great tonight. So, again, we're talking about preconception care, maternity care, and postpartum care. And what we've been saying thus far, and one of the things that I, stress, make sure you are taking a prenatal vitamin or folic acid supplementation if you are planning on becoming pregnant, if you are pregnant, or if you after pregnancy, if you are breastfeeding, you need to continue that supplementation. Okay. So make sure you're taking a prenatal vitamin. And then one of the other things that I just wanted to also touch on is the chronic medical conditions thing, because when you have a chronic medical condition, pregnancy can sometimes make that thing worse, and sometimes it can make it better. So when you, let's say, there are a couple different go through a couple different cases. One is if you are someone that has a thyroid disorder, whether it be hypothyroid or hyperthyroid, meaning your thyroid hormone is functioning at a higher level or lower level, um, or excuse me, your thyroid gland is functioning at a higher or lower level. That means when you are now pregnant, the way that that gland works is going to be different. And so if you are someone that is on thyroid supplementation, the dosage of that thyroid medicine will need to be adjusted while you are pregnant, and after pregnancy it will need to be adjusted again. So it is not something that you should ignore or say, it'll work out. This is absolutely one of those things that you need to be touching base with your doctor about. Also, if you have high blood pressure, if you have diabetes, achieving control of these things, so making sure that your hemoglobin A1C is in the acceptable range below 7. If you're diabetic. If you are someone that has hypertension, high blood pressure, you want to make sure your blood pressure is controlled into normal range. um, and then the same thing, if you have thyroid dysfunction, you want to make sure that TSH is in normal range. So once you get into pregnancy, your pregnancy can throw those things out of whack. So you want to make sure that you are attending, and I said this before, attend all your prenatal appointments, because those things are going to be monitored and your medications are going to be adjusted as necessary. Now, I have seen people who thought, yeah, I don't want to take this medicine while I'm pregnant. It's going to harm the baby. And, while I understand the concern, the truth is that your chronic illness, regardless of what it is, your chronic illness being out of control can potentially be more harmful to your baby than actually taking the medicines that to control it. Now, the medicines that you use for control, like for instance, when you have high blood pressure, it's not all high blood pressure medicines that you can take during pregnancy. So the actual medicine itself may be switched to something else that it would be potentially less harmful or not harmful to the baby at all. So again, if you have one of these things, you need to make sure you have an OB. Okay? You need to make sure you have an OB, because you don't want to continue taking certain medicines that may need to be adjusted while you're pregnant. So if you are planning a pregnancy, talk to your doctor. If you found out you're pregnant, talk to your doctor. Have those conversations, because I will tell you that it is the best thing to make sure that mommy is healthy and to make sure that baby is healthy. Okay? Uh, Hope that answered your question. And for anyone else that's on, thank you so much for joining us. I'm Dr. Thorpe Mize. We're talking about preconception care, maternity care, and postpartum care. And I'm so excited to have you guys join me tonight. We've had some great questions so far. And if you're just joining, make sure you type your questions into the comments. Some of you previously mentioned that you are not able to ask questions because of the nature of the platform that we're using. So if you have questions that you want me to answer and you're not able to type them in, um, you you can either send me a message on one of the other social media platforms, on Facebook, uh, Instagram, or Twitter at Amize Health. I'm checking those and we'll be happy to answer questions from those also. Okay. I'm just checking right now. Do any of you that are currently on have any questions that I can answer for you? So, thus far we've talked about so many things. So it's been a great session so far. For preconception planning, I'll just run through really quickly. Work on achieving a healthy body weight. Work with your doctor um, to manage any acute or chronic medical conditions. And then make sure you start a prenatal vitamin or folic acid supplementation. That's before you even get pregnant. Once you're pregnant, make sure you have an OBGYN, attend all your prenatal appointments, continue that folic acid supplementation or prenatal vitamin, and then postpartum, make sure you still go to those appointments. Um, you want to also make sure you're attending the appointments because they want to monitor any gestational or meaning pregnancy related conditions, and keep an eye on things and answer any questions that you're having. Okay, so another wonderful question here. What sitting, sleeping, resting positions would you recommend to avoid back pain? That's an awesome question, but it's so specific to the person. Some people like to lay flat on their back as a sleeping position to avoid back pain. And typically that works just fine until you get so far in the pregnancy where laying on your back might cause the baby to actually compress your aorta, which can happen, and can cause like lightheadedness and other difficulties. So usually as you get further into pregnancy, you'll realize that it's actually more challenging to lay on the back. So it's okay to start off that way, but oftentimes what will happen is you need to lay on your side really to prevent yourself from compressing vessels. So you want to lay on either side. Sometimes what can be helpful is to kind of wedge a pillow below the abdomen just to make you feel more comfortable. Sometimes you can have like pains that come from alignment issues. So putting a pillow between the knees or between the legs can sometimes ease some of the tension that may end up causing some hip pain. And then sitting really with either, for some people, cushion at the back may be helpful. Some people sitting against something hard is helpful. It really does depend on the person, but I do recommend finding a position, whether it be sitting or laying down when you're sleeping, finding a position that's comfortable for you. And that's gonna, like I said, it's gonna vary from person to person. um, but just keep in mind, as the pregnancy grows, laying on your back will become less and less of an option because of the concern for compressing those vessels in the back. Okay. But otherwise, I do think it's sometimes it can be very challenging to find a comfortable position, but it's something that you can do, you can accomplish. So just keep trying. Okay. And then that was another great question. So for anyone else, any questions, just go ahead and type them into the comment box, and I would be happy to answer. And I'm going to go ahead and check to see if I have on any of these other platforms, whether or not any questions have popped up on any of them thus far. So thank you guys so much for participating and joining in, and submitting your questions. You guys have been great thus far. And as I said, you can reach me on any of the social media platforms. Typically, we will continue. What I've been doing is I do a topic released every Monday, for 3 Mondays in a row, and then on the fourth Monday of each month, we do these Q&A sessions, to so that I can answer any questions related to those specific topics. If you want me to talk about a particular topic, go ahead and send me a message, whether it be in the comments or via one of the social media platforms or on the website. and let me know things that you want to hear about, so I can make sure that I'm answering questions about, things that you guys are concerned about. Um, and one of the things that I wanted to bring up is ways that you can get in touch with me. Like I said, I'm on social media, but I also will be moderating a conference on April 22nd in Atlanta, and that conference is about diversity in clinical trials. So if any of you are interested, we will be placing that information online for you to remote in, or you can come in person by registering. If you go to the website sonarcr.com, and you can join that way and come and support and find out more about how you can get involved in terms of diversity in clinical trials, or hear more about it. So, any additional questions regarding preconception care, maternity care, or postpartum care? And I did, like I said, I had people send in questions for me, and I've been trying to answer them as much as possible. So, there was a question: what things should I consider when I have a comorbid disease such as sickle cell, and when I'm trying to get pregnant? So there are different things to consider based on the specific disease. So if you are in the process of planning, um, it depends on management. So again, like I mentioned before, you want to make sure that you have the best control over your illness as possible. Um, you want to touch base with your doctor. So if you're, like, for instance, in the case of sickle cell, if you're seeing a hematologist, make sure you touch base with your hematologist. You can, for women in particular that are um, desiring pregnancy and have sickle cell, it can be difficult. So if you are having difficulties conceiving, this is one of those things that, again, I would have a conversation with my OB about, because there are options that you can consider if you are having difficulty. And in particular with sickle cell, sometimes women will tend to have miscarriages. And like I like to stress to people, having a miscarriage is not your fault. It can happen though. So, if this is something that's happened to you and you're either having difficulty conceiving, have a conversation with your OB about it, to see what the best method is to move forward. Now, if you are already pregnant, you want to make sure, again, that you're taking that folic acid, which, a lot of people with sickle cell should already be on folic acid, or are already taking folic acid or another form of medication to control. So you want to make sure you're taking folic acid and doing what you can do to make sure that you're carrying a healthy pregnancy, which means touching base with your OB. Okay. Any additional questions regarding that or anything else? So, I'm just looking through here because like I said, I did have some questions sent in before. And so another one was whether or not um, you can play classical music to your baby. Absolutely. Absolutely. So if you decide that you want to play classical music to your child, some people are like, will notice that their child take an interest in some of the things that they expose them to, you know prior to birth, like during the pregnancy. So I would absolutely recommend doing that. Some people feel like it's really good for their development, for their brain. I would say play the music if you want to play the music, but one of the things that I tend to like to tell women in particular is talk to your baby. If you are pregnant, talk to your baby, because your voice is what they will hear. You know, again, your voice, they'll hear your voice and get comfortable with your voice. So talk to your baby throughout the pregnancy. Um, if there is a partner involved, partner talk to the baby. They hear you. So I would recommend doing that. But if you want to play classical music, absolutely play classical music. Okay, I don't, I'm not familiar with all the research that's been done on classical music use uh during pregnancy. So I don't have the keys to tell you about that particular one, but there have been a lot of good that comes from basically playing, whether it be playing music, like I said, talking to your child, engaging even prior to the baby being born. So I would recommend you going ahead and doing that. So we have about 10 minutes left. And so I'm going to just do a quick roundup. If anyone have any additional questions, go ahead and ask. I'll continue to check to see whether or not we have any additional questions. And if you have any questions for me and you're unable to place them on this platform, like I mentioned before, you can absolutely send me a message on one of our social media platforms, Facebook, Instagram, Twitter, LinkedIn, at Amize Health, and I'll be happy to answer your questions that way also. So this session, we've been talking about preconception care, maternity care, postpartum care. So, overall, as we begin to wrap up, I just want to say that number one, you want to make sure that you're doing what is best for you and what is best for your baby. If you desire pregnancy, if you desire having a baby, begin to work on achieving a healthy body weight if you're not already doing that. And like one of the questions that was asked, one of the ways that you can do that is to begin an exercise regimen during your planning process. Make sure you're talking with your doctor about any medical conditions that you may have, anything acute, getting tested for any STIs. If you have any STIs, making sure that those are treated. If you have any chronic medical conditions, if you have diabetes, get that A1C under control to less than 7. If you have high blood pressure, you want to get that blood pressure down. Get your For people with thyroid disorder, get the thyroid under control. For seizure disorder, same thing. You want to make sure everything is under control. You want to start taking a prenatal vitamin. All prenatal vitamins usually have folic acid, but if you decide, oh, some people don't want to take a prenatal vitamin. Why? Because it has other vitamins in it. And so some people feel like, well, I'm already eating a balanced diet. I don't want to take a prenatal vitamin. Well, if you don't want to, then just take the folic acid supplementation. Make sure it's 800 milligrams per day, okay? And then you do all of that. Once you get pregnant, make sure you have an OBGYN. Make sure you are attending all your prenatal appointments. Continue to take that folic acid supplementation, continue, or the prenatal vitamin. And then, if you notice at any point during your pregnancy that you're having vaginal bleeding, you want to make sure that you have a conversation with your OB and get evaluated in person. If it is a lot of bleeding, you need to be seen in the emergency room, okay? And get that evaluated in person. And then once you have baby, the first 42 days tend to be the most critical. We consider the 12 weeks after having baby the postpartum period. We want to make sure we check up on you in that postpartum period because there are conditions that we need to evaluate for pregnancy and common postpartum medical complications. We want to make sure you be evaluate that you're not having any. We want to evaluate for any conditions that started during the pregnancy because some of those can affect your long-term health, such as if you end up having gestational diabetes, meaning diabetes that occurred during the pregnancy, or gestational hypertension that occurred during a pregnancy or right after, those things can have an effect on your long-term health. And women who have those things that pop up in pregnancy are more likely to develop them outside of pregnancy. So we want to make sure that you're getting followed. And then the other thing, like I mentioned before, postpartum depression can happen for longer than the 12-week period. So if you feel like you are down, if you feel like you're not yourself, you know, you probably are not. You just had a baby. And if things are a challenge for you, things are different, and you feel like you need to talk, just mention it to your doctor. They'll do an assessment, determine what next steps need to be made, do the appropriate follow up with you. So talk to your doctor about this, okay? We do not want you to suffer in silence. There is help. So talk to your doctor. Now, after those 12 weeks, you can still talk to your doctor because guess what? Postpartum depression can go far beyond the 12-week period. And I just want people to really understand that because we do not want to leave you to suffer in silence, okay? So please do that. And then last but definitely not least, for maternal, for people who are breastfeeding, if you are breastfeeding, I want to say a couple things about that. Number one, make sure you're still taking your prenatal vitamin if you're breastfeeding, okay? Take that prenatal vitamin. And the other thing is, if you are thinking that you are going to use breastfeeding to prevent getting pregnant, don't do that. Don't do that. You can still get pregnant. So you want to make sure that you talk to your doctor about next steps because you want to make sure that you do contraceptive planning. And so that's part of what happened in that postpartum period. We want to make sure that you don't end up getting pregnant too soon. Okay. Or if it's not something that you desire, some people don't want to have a baby right away. So you want to make sure that you have some form of contraception management. So don't think that, oh, I'm breastfeeding, that's enough. I don't need to take anything. That is not true. You need to take something. Okay? You need to take something to prevent another pregnancy. Otherwise, you can have back-to-back pregnancies. And, people do it, they survive. It's not the end of the world if it happens. But if that's not what you desire, you want to make sure that you are taking some form of contraceptive. And, that's one of the things that I'm going to be talking about pretty soon because I don't think a lot of people understand what all their options are when it comes to contraceptives. So, we'll, stay tuned. We'll be talking about that pretty soon. Okay. So, we have had a wonderful discussion today. I'm so glad that you all joined me. We talked about preconception care, maternity care, and postpartum care. And I would like to think that we got a lot of good information out there. So, if you guys have any additional questions for me, feel free. Send me questions on this platform or on any of the social media platforms at Amize Health. I'm happy to have conversations with you. If you guys have any specific topics that you want me to talk about, absolutely, again, at Amize Health. And the other thing is, if you want me to speak at your event, contact me either the website at amizehealth.com or you can reach me on one of the social media platforms. Remember, I told you about we have an upcoming conference, Diversity in Clinical Medicine. I'll be moderating, so you get another opportunity to see me in action. So join us on April 22nd. It's at the Gathering Spot, or you can go to Sonar CR, SONARCR at sonarcr.com, and you can register for the conference there. And if you do, I'll see you there. Okay. Okay. So we are just coming down to the last wire. If you guys have any last minute questions that you want to get in before we go, be sure to do that. It's been my pleasure talking with you guys tonight. I'm so happy that you were able to join me and get your questions answered. You guys had some great questions tonight, and I'm proud of us. We did it. Another one under our belt. We did it. Thank you for joining me, you guys. Have a great night.